I do what I do for the people. I like sharing in people's lives, and when you are a doctor, you get to see people when they're having tough times and when they're feeling better, and guiding them through that experience is personally and professionally very satisfying. There was an encounter early on when I was a medical student just doing clerkship. I didn't know very much about medicine. I didn't know about the diseases that people had. I was just starting out, and one of the first patients that I met was an older gentleman who had really severe aortic stenosis. And we've gotten better through the years at treating aortic stenosis. We've got a lot more technology and techniques that we can use to help patients with that disease. But back then, he had gotten to a point where it was pretty bad, and he had a really bad heart failure from it. And he didn't want any surgeries or any interventions. And we helped him the best we could. He kept coming back to the hospital once a week with heart failure. And what I realized was he wasn't coming back as much for medicines and for our professional expertise as he was just for the support. It gave him comfort just to be there with us, to know that somebody was there taking care of him, looking after him. Just being there, holding his hand through those last days seemed to make a big difference for him. He gave me a nickname. He called me Smiley. And every time I walked into the room, just as a medical student, didn't have any real way of helping him feel better physically. He seemed to feel better just seeing me and sharing a smile. That encounter, more than anything else, made me say, yeah, this is what I want to do. Social support is incredibly important. We get to help them for half an hour, once every week or once every few weeks if we're lucky. But to have someone there day in, day out, motivating them, supporting them, taking care of them, really provides them what they need to get better. Emotional support is why.